So I'll be talking about, the first talk today that I'm on is about nutrition in schools with a focus on the ag programs really in gardens. What I plan to address is in this order, and we'll see how I do on time. But you've heard about the current health trends in children, and many of us in the field have seen the billions of slides looking the same. So I'll quickly talk about that. But then I want to move into more of my passion on garden-based nutrition education, farm-to-school programs, and then a real thrilling thing we're in the middle of right now is a research program on multi-component nutrition education program. And can you hear me okay? This thing keeps fluttering. Okay. Well, we know that children's diets are not meeting national U.S. recommendations, and same with desired physical activities that are not being met, and that obesity rates are increasing, and adult diseases are showing up in children, so things are starting early. And really the exciting time to start working with our children and with our population is as young as we can. And you heard a lot about maternal nutrition yesterday as well. But I don't, this slide's not very good, but I put it up here just to show you about, these are the national indicators for diets, and just showing you basically that children, again, they're not meeting recommendations at any ages for fruits and vegetables and whole grains. And they're above those for those recommendations where we're trying to reduce in terms of dietary fat and sodium and food components such as that. And what we're really seeing is fruit intake might be okay. It's really the vegetable components that are substantially below what's recommended. So a lot of our focus in schools, we'll talk a lot about fruits and vegetables, but my goal, or our goal in our research projects, is trying to get kids to not just eat vegetables, but to enjoy them, and then learn to incorporate them as part of their lives. And again, we know that children are not meeting activity levels. Less than 40% are meeting current physical activity recommendations. And this is a slide, I'm not sure if you saw this exact one yesterday, but many of us in the field have seen this over and over again. And sometimes I get embarrassed about showing it over and over again. But what it shows you are the age groups in the gold there. I'm used to having my pointer. It's gold sort of color in the younger children, and then 6 to 11 in the green line, and then in the blue line, how it's, and those are in children between 12 and 19. And you can see how it's it's increased over the years. Maybe plateauing off a little bit now, but substantial increases over the years. So what can be done? Well, the school setting is where we focus, and it really does seem to be an ideal place for creating a healthy environment. And that can support physical activity and nutrition. But it's not a place where we could go in and just say, here, you need to eat this. We're going to change the rules, we're going to pull sodas out, we're going to tell you not to watch TV, and now everything's going to be okay. It's we need to increase enthusiasm about wanting to enjoy that healthier environment. And that's really where I find a lot of the excitement right now. We have focused quite a bit on gardens. We know that children lack an understanding of the impact of farming on their lives. The incorporation of ag into the school environment and the classroom curriculum is a way of really stressing to children and adolescents the importance of a healthy diet. It can help them get excited about being part of that healthy environment. School gardens have been around for a long time. How many of you, when you were in school, if you were in school in the United States in K through 12, had school gardens? Just a few. Because they're very popular now, but they started in Europe. They arrived in the late 1800s. Then they increased, then its popularity sort of died out, and now there's a recent surge in popularity where many schools have gardens despite the cutbacks. They might have a place for a garden. They don't have a lot of the funds to maintain that garden. But what's important is to investigate these different types of healthy eating alternatives. Many national committees on reducing childhood obesity have suggested gardens as an innovative method of improving children's health. And really, schools can provide this sort of hub of networking for families, for health partners, for the ag community, and other community members. Of upper elementary school age kids or children, and those ended up being 4th through 6th graders. So the lesson topics are shown here. There are 9 of them, and then we had a gardening component that was linked to each one. Was linked to each topic. There was in-class discussion, and there were hands-on activities. So we went through a bit of time of piloting this and testing it in different schools to see what worked and what didn't. And then we had an intervention to see if we could actually measure outcomes. And at that point, no studies had been published actually doing this. So this is just briefly a diagram of how we designed the study. So there was a control, and then there was what's called the classroom-based nutrition education, and then the garden-based nutrition education. And then we collected data prior to the intervention, and then they had their intervention over the course of the academic year. And then there was post-test data collected. And then 6 months later, we had follow-up to see if they stuck with any of these changes. Okay? And so what you'll see is it's sort of color-coded, where controls are going to be in the darker blue, and then the classroom-based in red, and the garden-based in blue. Okay, and so that's what's shown here. So a lot of times I'm not sure how much you hear about, we don't worry so much about nutrition knowledge, we want to see behavior change to know if something's working. Well, it's not so true. We need to see knowledge change too. That's a very important component. I mean, learning is an important component for all of us, but it's a good measure of whether students are actually getting anything. And then we hope to see that they put it in action. So what this shows are the mean knowledge scores, and again the data bars are the controls are in the darker gray now, and then the classroom-based in red, and the garden-based nutrition education in the blue. And you could see there was an increase in both the classroom and the garden-based education at post-test, and then also at follow-up. So 6 months after they hadn't even heard about anything, they still retained that knowledge. Now this is a little bit more confusing slide, but it's the same color coding. Okay, and this is their preferences for vegetables immediately following the intervention. And it's just, again, these children are presented with vegetables, and then they're deciding on whether they want to taste it, plus answering quite a few questions about it. Would they choose it at home? Would they ask their parents to purchase it at the store? Would they want it as a snack? And this had been a tested questionnaire that we had tested earlier in pilot studies. So basically, without going through each data point, but you can see that for several of the different types of vegetables, carrots, broccoli, snow peas were very exciting, and zucchini, we saw an increase in their preferences, and we saw that was more substantial in those that also had the garden-based nutrition education. And that, without having enough time here, these were also, some of these were the ones that the children actually planted in their gardens at school. This was their preferences 6 months afterwards. Some of the great significances or the differences had been blunted a bit, but they were still there. So we saw that their preferences for vegetables maintained 6 months after the intervention was over. They were also asked about their willingness to ask a family member to buy vegetables. And you can see that post-test It was highest in the children that had received the garden-based nutrition education program. Didn't really stick with that so much at follow-up, showing we really need longer-term interventions and perhaps multi-component ones, which we'll talk about in a few minutes. Willingness to eat vegetables as a snack, again, with the garden-based, which is shown in the blue, both at post-test and follow-up, we saw a difference. We saw that it was increased. So we concluded from this curriculum that that program was effective at increasing nutrition knowledge, increasing preferences for vegetables, their willingness to ask family to buy vegetables, and their willingness to eat vegetables as a snack. Now this age group is really, for our purposes, a very good one to work with because they're not so concerned with pleasing you. These are 4th through 6th graders. These were 4th graders. When we worked with younger kids when they're in 1st grade, they're happy with everything. They're just smiling, they'll taste things, they want you happy. 4th graders, not so much. They don't care that much if you're happy, they're answering questions, and we had seen that in our results. So this was the curriculum we published in collaboration with the California Department of Education, which has been a longtime partner of ours since then. It was published in 2001. It was updated again in 2008 with changes in my pyramid. And then now with my plate, we've updated once again, and it should be released in 2012. And it's on our website that's shown here. That's our website in the Department of Nutrition. So since that time, there have been other studies that have looked at garden-based nutrition education, different curriculum, and effects in different ways, and have done more substantial work, really, than we were able to do then in actually looking at dietary consumption. And that's just shown here. So there are several different garden-based nutrition education programs that have shown increases in nutrition knowledge and consumption of vegetables, which has been expanded since our studies, and preferences for vegetables like ours, and then the willingness to buy and to eat them as a snack. But the field is growing with more and more studies now being able to replicate these types of results. So again, school gardens are an engaging environment for use in comprehensive school programs. They can be allow for enhanced communication between the schools and in terms of the students, between the families and their communities, and they link schools with families and communities to promote healthy families or healthy lifestyles and prevent disease. They require money, they require commitment of the school community. Quite often parent volunteers need to have a lot of activity on the campus as well, or on the school site. So there's been other studies that have shown not only nutrition improvements as a result of school gardens, but also academic achievement. I've mentioned health and nutrition education, but also environmental stewardship, where they're learning more about the importance of their environment, community and social development. So I'll talk a little bit about that. There's just been a few studies showing achievement tests. And this is really critical when we want to get, I guess the best way to put it is buy-in from the schools. The teachers are bombarded with commitments and with requirements for their test scores. And in K through 6, K through 12, the teachers really have to focus on improving test scores. So why would they want to let us in or let anybody in to start teaching about gardening and nutrition? Well, we need to tie it into the test scores, and we need to tie it into the different content, core content that they're teaching. So science scores are a big deal, something we want to look at. And so there have been studies that have seen higher science achievement test scores as a result of gardening and environmental learning. And unfortunately, Dr. Martin Smith was going to lecture before me, had some more information on that, and he is really one of the leading experts in more of an inquiry-based education approach, but we're working together now in this area as well. Also, there's been studies, there need to be more controlled studies, but there's been studies with the Texas Master Gardener program that have shown that classroom garden projects improve self-esteem, sort of a sense of ownership and responsibility, family relationships, and parental involvement. These are hard to measure. These are hard studies to get published, and they're hard studies to get funding for. So better really, I guess you'd say, tools need to be developed to be able to measure this. But when you're actually there and you're observing the kids, you know it. You can't publish that, but you know it. You can see it with these children. They get into it. So after we started working with the garden programs, and then there's been several studies since then, but also the realization that it's not just about garden programs. We need to have more of a multi-component program to have an actual impact on children, in terms of an impact, meaning in terms of dietary choices, lifestyle choices, and overall education. So we also, a postdoc of mine, Carrie Heeneman, worked on this program called Improving Children's Health Through Farming, Food, and Fitness. And in that, we established salad bars. These were pilot studies that we did in the Central Valley and in Sacramento. We incorporated nutrition education into the classroom. We created a garden and also developed a food waste composting system. And this was done in collaboration with Cooperative Extension in different areas of the state in terms of county offices. So in this, we worked at, these are just the schools. This is called Rock Creek and American Union Elementary School. We did see improvements in their nutrition knowledge. We had great quotes from parents, from school staff. The program is opening a window for children. Students participating in the program like the new veggies and fruit each week, and they're all trying things for the first time and learning so much. Students now realize how important it is to be active, to eat healthy, and learn about the food we eat. And these were in younger children. These were in second graders, so earlier than, or younger than the ones that we worked on with Nutrition to Grow On. So just some of the results from that is shown here. But you can just see the schools, and we had no controls here. This was a pilot study. We wanted to see if this type of multi-component program could work in the elementary school, especially with the limited time teachers and staff have. And so one of the things we found was decreased soda consumption, and another was decreased computer use. Now understand that when we did questionnaires with children, they thought that they were getting physical activity by using computers because they knew they could learn on computers, so that must be good, so that must be physical activity. So that, and now you actually can with some of the little dance programs on the different types of video games, but in terms of computer use, we did spend some time explaining to them that sitting and learning at the computer is actually not physical activity. So we were happy to see that. We saw increased consumption of fruit, and we saw decreased consumption of cookies. So this was the beginning of us looking at more of a multi-component type of projects where now we're bringing in salad bar and as well as a garden and some other environmental consideration, as well as classroom education. This was a curriculum that was developed from that in collaboration with UC Cooperative Extension in Placer County. And this was a garden enhanced nutrition education for kindergarten, first, and second grade. That's also on our website. So another program that goes with all of this is called Farm to School. How many of you have heard of Farm to School programs? Okay, very few of them. And again, it's reaching a lot of, becoming much more popular now. And it's very, very general. It's any type of programming that'll connect schools in K through 12 with local farms, and it has the objective of serving local and healthy foods in school cafeterias or classroom. There's common goals, all handled totally different in every farm to school program because it's very district dependent. It depends on what they need and what they want. Okay, but common goals is to improve student nutrition, although there's no nutrition education required as part of a farm to school program. And then providing opportunities for ag and health and nutrition education, or opportunities in that whole area. And then the idea is also to support small and mid-sized type local and regional farms. It's a national program. School foods are purchased directly from farmers. There are these experiential learning type of opportunities. They'll go to farm visits. They'll go on field trips. There may be gardening, may not. And there's recycling programs. Again, may or may not have those. But the idea is connecting farms to schools and teaching children about that connection for health, but also to know where that food's coming from. It's not just coming from the supermarket. Okay, and so the farmers oftentimes will participate in the programs to educate the children about the food system, about agriculture, and about local foods. The issue with farm-to-school programs, while they're popping up all over, is their evaluation. They're all so different. It's very hard to really be able to say, this program has had this effect on our children. Because to do so, as you're learning in your classes, is you need really to have controls and an intervention. You need to be able to compare results of an intervention to a control to know if what you did actually caused that result or had an influence on that child's behaviors, for example. So there's been reviews done on findings and future needs. So I'm going to give you a little bit of a taste of that now, but realize that many of those have not been published. They're published in reports. They're published on websites. We're working with many of the people with Farm to School now to incorporate it into our programs where we have controls and interventions when we can. But they're increasing in numbers, very few publications. But quite often they'll try to look at fruit and vegetable consumption from a salad bar. They'll look at school lunch participation, but realize also when you're going into schools that are very highly populated by low income, there's already a high participation in school lunch because it may be free or reduced. So it's hard to find changes in that in those schools. So it depends on where it's done. Student knowledge and attitudes occasionally is looked at. Food service behaviors, meaning what the school lunch program is now serving, if they're serving local and regional produce now, if they've maybe increased the variety. Farmer behaviors and parent behaviors. And of course this review came out with further evaluation and research is needed, and it certainly is. This is just to give you an idea of some of the better programs and that have been posted on that Farm to School website that's shown here. And what's shown here, this was done in Oregon, and this is they had several integrated educational activities. The Harvest of the Month is what HOM is. They had farm field trips, they had garden sessions, nutrition lessons, tasting tables, they had harvest days, so they had whole school involvement. They had a lot of excitement. Again, it wasn't controlled in such a way to do very strong measurements of things, but they could see, again, from visually taking a look at what's going on from observations, the excitement, basically. And so these are the results from that study, is that from some of the measurements they did take, that they increased fruit consumption, and they had an increased knowledge about locally or regionally grown produce. In this example was in Oregon. And then different perspectives for educators and farmers were shared to try to develop a better network for local farmers and distributors to get their produce to the schools. So there were a lot of benefits in that way. This was done in Riverside. We have a very active, very exciting nutrition service director there that gets involved in a lot of things. And they had salad bars without any real educational activities at that school and in that district. But they saw that salad bar eaters, as they called it, consumed 2 times more fruit servings and close to 2 times more servings of vegetables than hot bar eaters. So in that school they had a choice of going to the salad bar or having the regular hot food. They did start developing a stable market for produce grown by relatively small farmers. And they did facilitate this farming cooperative, which we're starting to see now develop throughout California. Again, that networking is key. The nutrition service directors of these districts, they're basically running a business. They're on a very limited amount of funds to get their work done, and so they have to create sort of, and work to help to create this avenue with the local distributors and farmers to get that produce there to fit their budget. So what are the potential benefits with farm to school? The children, again, can start the habit of eating more fresh, locally produced food early in life, especially when it's supported by food and farm education activities, including gardening. Farmers develop new markets, and communities can gain a better understanding of agriculture. And this can be done whether it's in urban or regional areas. There are avenues in which to connect with local distributors. What I do want to stress here is it is nice to have the children to start getting into the habit of having local, fresh produce. But we want to be careful as nutrition educators and nutrition scientists not to give the impression that it's not okay and it's not healthy to have frozen or even canned fruits and vegetables. Our idea in nutrition and in this area is to increase fruit and vegetable consumption among youth and among adults. Having fresh may appear to taste better, and in some cases, depending on when it's harvested, may be higher in certain nutrients. But I'm always very careful in our programs with the schools is we want to get the children to enjoy and consume more vegetables and also fruit, but vegetables are a pretty big deal. So this is just showing you how Farm to School does provide a great opportunity for collaboration with school nutrition professionals, with dietitians, with environmental educators, with farmers, teachers, with ag, master composters, with master gardeners. How many of you have ever even heard of master gardeners? Just one, two. With cooperative extension, there are master gardeners in most every county that can work very closely with nutrition and with different parts of the ag components of the program. And we are very lucky to be able to work with master gardeners to develop our programs. And they can go into schools to help them with their gardens, to also provide educational opportunities about agriculture and gardening for parents, for the community, and for the teachers and students. Community and seniors, quite often you can have senior centers, people from senior centers or other seniors volunteering in the gardens. It gives them a sense of welcoming. They want to be part of the schools. They might be working with their grandchildren in the schools. Different cultures can participate because they can add all their knowledge of what they may have learned and bring that into school, where they may not be able to help in the school, for example, in math tutoring or in different other areas of the typical content that's taught. But they can bring in this vast knowledge on gardening and what they've done in agriculture. So it's a great sort of hub, as I mentioned, to bring people closer together. And parent and food culture specialists. I mean, Lucia had mentioned how one of the parents said that the schools are giving these horrible foods, basically, to the kids, and that we're offering pizzas and so forth. Well, with these types of programs, there's an appreciation of the different cultures that are attending, of the students that are attending the school. So the idea of many of these programs is to bring in and introduce different cultural foods. And it's a major part of our program to bring that in so we can address everybody's interests and also bring in the families. Because you can't get anything done really with the children and have an impact unless you're addressing and including the families. So this brings me to really okay, what's my favorite thing to talk about right now? It's our program that's called Shaping Healthy Choices. We just now developed our logo, and which you have no idea how long that took and how much permission we had to get to use the little apple here. But anyways, it is a highly collaborative project that we're doing at UC Davis that's been funded through the University of California, and includes our department, members from our department, including Francine, and Department of Human and Community Development. Like I said, we can't get anything done without working with families, and so we have faculty members and graduate students from Human and Community Development, which I now think is called Human Ecology. The Ag Sustainability Institute is also on campus, and when I mentioned the farm to school programs, we have key leaders that have been established and have done a lot of those reviews, for example, and work closely with farmers that are from that institute. We have a Foods for Health Institute, where we also have a postdoc that is from that institute that is helping us with the physical activity measurements.